The Mount Sinai World AIDS Day event is a celebration for our community to have a way to honor those living with HIV globally, and we directly support youth who are living with HIV in Kenya. My name is Dr. Rachel Vreeman. I am a pediatrician and an HIV researcher, and I specialize in caring for children and adolescents who are living with HIV in some of the world's poorest places. When I think about global health and I think about HIV, I really think about the stories of the children I care for in Kenya. I think of stories like Peter's story. When Peter first found out that he had HIV, he thought all hope for the future was lost. He was 13. His father had already died from HIV the year before, and Peter had been infected by his mother at birth. Peter thought that HIV meant the end of his story. And this year, COVID-19 is making the challenges that adolescents like Peter and his family face even more daunting. Many families no longer have any income, many do not have a secure place to live, and they're in desperate need of food. And that makes it even harder to figure out challenges like finding PPE or having access to your medicines for HIV. We want to help children and youth living with HIV know that this infection is not the end of their story. In Kenya, I work with a program called AMPATH that was born out of a partnership between Mount Sinai, Moi University in Kenya, and a number of other North American medical schools. AMPATH is one of the world's largest single HIV treatment programs, and through this partnership in Kenya, we provide HIV care to 15,000 children and adolescents and 150,000 adults who are living with HIV. If you talk to Peter today, he'll tell you that he found hope in a support group at his clinic that was for other kids and youth just like him. He said, "This group became my family. It was the only place where people understood the burden that I was carrying. It was the only place where I had friends who believed that I could go far." And as the COVID-19 pandemic has spread, we've been struggling to find ways to offer these kinds of support groups and other support virtually to our kids with HIV. We've also lost the funding to keep counselors in the HIV clinics. Kids like Peter need support services, counselors, peer support groups, safe places, and fun places where they can connect with other children who are just like them. They need this now more than ever, and they need this virtually and in person. They need support as they grow up so that they can understand that HIV is not the end of their story. To make this kind of change happen, we need partners to join with us and to stand with kids like Peter. We need a community that's going to stand in support and partnership with kids and youth who are living with HIV. Please donate today to help families with children living with HIV.